opens the door and now he thinks it smells. Hi, Mama. How are you? Oh, we can take this down.
I can. No, I'm totally. I help with them at my house all the time.
Hey, everybody. Guess who's here? All right, where do you want to sit?
I sprayed myself with Feel Away before it came.
Oh,
So I was hoping that would be a calming effect.
Cat invisible. Do you want a box or do you just want to sit in?
I can sit. I can sit for sure. I just don't want to. Yeah, perfect. Where's
move
the?
This?
Maybe sit near the box.
Yeah.
Or you can maybe. I kind of want us both too because I want to feel her without being invasive, and also I want to peek at kittens too. Right? Out of the way. Is this a? Where's the? Tiny.
I think that's my phone. Let's see what it's warm in here.
It's lovely.
It's kitten temperature. Okay, so I should turn some lights on.
And where are you at with the naming situation?
Oh, you mean as far as
It's like how I can keep track on a piece of paper? I mean, for interest and for practicality.
well, I've announced one name, but I can.
Hello, gorgeous. How are you? How are you? Can you say hi to me?
Look, it's Dr. Ferguson.
Hello. Oh, she's making bread.
Yeah, she likes to make the bread. Look at this.
Oh, there's so much more Tabby in person.
I know. 4 tabbies. I think
Hello.
I know who the daddy was. Because there was a big fluffy tabby at the house where she came from.
Yeah, I remember you saying that. Hello, gorgeous. Don't bug you too much. You can get used to me for a minute.
I should get my laptop. So,
What do you think would be less invasive, to check her sort of in there first and then do the kittens, or do the kittens and then do her? I mean, they're all going to get stirred up,
she'll
unfortunately,
probably
anyways.
come out if we handle a baby. She might come out if I open a can of food of her own free will. We'll see. Are you so excited?
Oh, look at that,
Yeah.
Dorothy.
You want some food? Where'd your bowl
Fresh
go?
food.
I know, it's so exciting.
There's so much more little. Can I pet him like this?
She's been pretty good about. She's nervous, but she's not too bad. There you go. So tasty. I didn't feel anything in there earlier.
I feel some kidneys, which is
That's good.
And a liver.
Good. Look, food. So tasty.
Uterine horns. They're wrestling.
They're okay.
Can I just have one little tiny peek up here? Sorry, sweetie pie. Yeah, I don't feel anything that feels like a kitten. You can feel her uterine horns and her kidneys. Maybe you're feeling a kidney was sticking out last night.
Yeah,
or bladder.
it was something. It was up in like this region, and it was.
I mean, if you think of sticking 6 cats in this area and then packing them on top and trying to count them on an X-ray, I think we did quite well.
I know, and yeah.
And we were confident we saw 6, but we didn't know with all the smush or all the little bodies on top of each other on the X-ray if we were going to see more or not. We left it open.
Yeah, I think you guys actually said 6 to 7, and I thought there could possibly be an 8th.
You're always so optimistic.
Because I know. I always see extra spines.
Why don't we break a
skulls.
world record in addition?
I know. For a first-time mom.
Good girl. Yeah, I think it feels quite good. She wasn't painful about it. Guess what? I won't take your temperature. The whole world thinks I always take their temperature. Good. Good.
She's eating. She's alert. She's, doing the panting thing every now and then, which is normal. She's a little.
What do her stools look like?
Like water. Like you can see some spray patterns on the wall.
I'm sorry, monkey. In a little bit, we can get your intestine inflammation calmed down, but we're just trying to not give you medication that will hurt the kittens. Oh, you have a very beautiful belly.
I tried to trim some of her belly fluff, but that was not appreciated.
Good girl.
She's very good.
Yeah. Can you see? Good. She's pink and she's hydrated. That's good.
Yeah. I've been mixing lots of water with her food, and she's been eating really well, so.
Yeah, she's hydrated. You can tell if they're hydrated by one of the ways. A lot of people you'll see do a skin tint, but sometimes, especially older cats, they'll lose their elasticity. And then, so if you touch their gums and it's not sticky or tacky and it's a nice color, and when you push on it, the pink goes away but then comes back really quickly, it tells you she has good perfusion and she's nice and hydrated. So I think that's pretty awesome.
That's an easy way to tell if there's a problem with the cat. Like if your cat is feeling, suddenly you think there's something wrong with it, or if it's not as bright.
Yeah, if you touch the gums and if they're sticky or tacky, then they're probably not hydrated. It's my favorite way. Vets will put together a bunch of different clues together to see if they're hydrated. She's absolutely hydrated. She looks wonderful. She still looks way better than that first time for sure.
So that's good. That's good. So, all right. So,
sorry,
I know. All right. So I will get you one of the two that I'm. Actually, I can wrap it. So,
okay. What do you call this one?
Clefty.
Ah.
Unofficial. That's his working title.
Can I get that?
Yeah, you can turn that on, or I've got one over here too.
Hi, sweetie pea. Can you say ah?
He gained 10 grams since yesterday.
Oh, what?
I didn't see any holes in there.
Yeah.
I didn't get a very good look.
It's not as doom and gloom as I kind of thought. It's not normal. Have to look up staging of cleft palates. We'll have to watch him to see how he did. Is this a boy?
Yeah, I think so.
I think so.
Some of them are very subtle.
To see how it develops, but it's not awful. Like
He's been nursing.
And nothing's coming through his nose?
Nothing's coming through his nose. He's gained 10 grams, which is more than anyone else.
Let's have a little listen to your
He has
heart
a special kinked tail, which is really cute. Do you agree, Billy? It's very subtle.
I think so. Don't hold me to that.
I know. I was like, I'll do it later, but it hasn't gotten better.
I know. Everybody really wants to know, but it's usually down on my priority list. You're probably honestly better at it than I am. I think maybe a Persian got in there.
Well, Daddy was floofy.
I'm just kidding. It sounds really good. Like, I don't hear any crackles in those little lungs. Let me look one more time. Hi, sweetie. You're very cute. Here we go. I'm glad you gained weight today. That's promising.
See, he's very special. Alright, so that's okay, that's good. I feel better. So we have to watch and see if he develops a hole in the palate would be.
So right up between where your front teeth are, up in there, to along the midline, right towards the back, there would be a separation.
Okay.
And we'll check the other kittens for to make sure. You're right. Something with his sort of frenulum nose area is not normal, but it doesn't look like it's interfering with him. He might just. Who knows? He might just have a funny smile.
He's the strongest one out of all of them. He like bulldozes his labor.
And it's just make sure he's gaining weight and you don't see milk coming through his nose, and we'll keep an eye on them. I'm hoping that we're not setting you up for heartache, but I would probably try, absolutely. And with this one,
so this one, this one's name is because and I think she's a girl and she only weighs 66 grams. So
we need to check.
She can't nurse. Like she has a lot of trouble latching on. So I've been bottle feeding her.
Did you supplement her?
Yeah.
Did she go for it? Did you have to use a tube or a bottle?
Bottle. I haven't learned tube feeding, and I probably should, but I've been avoiding it.
She wants to nurse though.
She does. She's hungry. She just
shine her a little bit more towards the light.
Yeah. She gets frustrated.
Said it was hard when I was trying to look on the camera because even in real life I often have to take a couple looks and hum and haw. Her palate looks okay to me so far.
Good, good.
I don't know why you're so tiny. I don't know. You might just be tiny, or she kind of wants.
She doesn't have all the. She doesn't have all her fur. She's probably just a little younger than the others.
Maybe we'll get her to. Let's have a little listen
just
to her
teeny
too.
Tiny.
Mm-hmm.
She's really bad at nursing, so hopefully she'll get better.
Yeah, if you can, and just put her on a little bit more and do your supplement. When I put, you must have. Did she feed recently?
Yeah.
Because when I just had my finger in her mouth, it wasn't dry. Like she's not dehydrated.
5:30, I did a feeding, so an hour ago.
I think you're cute.
She is cute.
Yeah.
Alright, so no concerns as long as I can keep...
She's just little and see... I mean, it's always
her
possible that the smallest ones do have stuff going on that we don't know about. Like maybe they don't have the right kidney function or liver problem. You know, you just never know that they're hooked up right on the inside. But from the... Actually, I can feel both of her kidneys right now. I can feel her left one and her right one. Her heart sounds as normal as I can tell. She has a suckle reflex. She's hydrated. She's just wee. You're just wee.
Right,
little.
Okay, good.
So hopefully,
I feel better.
Hopefully, yeah, I feel better.
Look how teeny she is. She's so teeny.
Oh, you know, before we go, I might take another picture of the little clefty one.
Okay.
If he's not nursing, you have to. I'll pull him off at the end.
All right.
And just because I might see if I can find out anything more. I have, if that is a cleft palate, I've never seen one so subtle. I've always seen them where they're much more black and white, and where there's like a hole up there, and he doesn't have that.
Okay, good. So hopefully it's not. And everyone else, I think, is healthy. They've all gained like 7 to 9 grams. She's not quite on top of bathing them so much, but
it's okay. You're fine. Hey, Shelly.
She's a little crusty. None of them got proper baths after they were born, and they still haven't.
She's having a vacation.
She's in her happy place.
She's got her doula, and she's good. She's got a housekeeper. She has a doula.
She does. It's true. Good job, buddy.
I know, you're very good. Yes. See, if you feel right, just that little bit right there, you can feel the kidneys.
Oh.
One there and one there. If you want to.
Are they teeny tiny?
About a little bit less than my nail, maybe size. Smooth on each side.
Oh. Oh, when he meows, he's got.
It's like, I gotta pee.
Oh. Ew, you have kidneys.
Do you call that one green?
Yeah. This one actually has a name. It's Marvel.
Oh, that's awesome.
Thank you. Because he survived 45 minutes of hard labor. Paving the way. That's one of the naming contest ones. Oh, is she biting him? Okay. Oh, sometimes they get little bites. Oh, sorry. Whoops. Oh, did I just...
Oh, was that the one I want to take a picture of?
No.
No.
He's, there are two that... Okay, this one. I think this one here lives here. This is the boy one.
Boy tabby?
Yeah, this is number 2. Oh, I should not bend over in front of... I'm not wearing my camera safe pants. Sorry, internet.
You're adorable. Say ah. He did. Ah.
I know, he did a little squeak.
I'm sorry. I think you're okay too.
This is the second born.
Goodness me, they're little peanuts.
I know, they're teeny tiny.
They're all so far hydrated though. That's nice, hey?
Yeah.
And they're pink and...
The 4...
Goodness
Well,
me.
5 of them gained weight. And the little one dropped from 73 to 66 overnight. And then I started feeding and she's back up to 73.
Wow.
But I was like...
This is truly a miracle.
I know.
Like, I can pretty much say that if she wasn't here, 0 of these little kittens wouldn't have lived. And
I know.
I'd hate to think, I mean, we're going to have to recover her intestines from all that parasite load and stuff, but still, who knows if she...
Yeah, it would not have been easy.
Good. You're very lovely.
Yay!
You're number 2 male tabby. Nice to meet you.
Waiting for the camera to focus. There it focused. Oh, it's so cute. There you go, see mommy. Here's a little black one. I think they like all these. So I think they're all boys except for maybe the tiny one. The tiny one may be a girl. This is... Stand by. I'm gonna give you the number. 6. This is number 6. I haven't announced all the names or picked all the names or announced the last winner of the naming contest.
Oh, that's so awesome, eh? Hello, little one. Nice to meet you. Number 6. Say ah. You look pretty good. You're pink and you're hydrated and you have a, looks like a pretty good palate. Hey, Shelly. There you go. She's being very good about the visit, hey?
I know.
When I was watching, I was like, oh, do I come over? Do I not? What if I stress her out and everything comes to a halt?
I know.
I was like, oh, she'll be fine without me. And you were. And then I didn't.
Fine being a relative term. It helps to get the don't panic text. Because I was definitely... There were some moments.
Oh, there was parts of me that wanted to put a little ultrasound probe up there and just check out what was going on, but in reality it would have been nice, but it wouldn't have changed what you did.
That's what's so hard, just knowing you have to just wait, and then at a certain point do like surgery. but there's really no in-between option.
Yeah. Well, then you're hauling her off to the hospital, and you're disrupting her.
Nobody
and
can nurse after.
No, you're putting them under anesthetic, and it was the right call. And you always hope you make the right call, but it's a tough.
And they're all okay so far.
Yeah.
So far, so
Awesome. 1, 2, 3, 4, 5. We're missing somebody.
good. This is number 3.
You're so pretty. Thank you. Hi, number 3.
My question has been answered about whether the tabby gene trumps the black color, like if the tabby pattern.
Is this scientifically proven, or is this like?
Well, I
your
think
scientific study?
I had read it on the internet, but I wasn't sure because I kind of have read about how the colors pass from mom to
Can I see the front first? It's my habit to start with
Yeah.
the front. Sorry.
from mom and dad to babies. But I'd never really looked into how tabby gets passed down.
Okay. I know. Okay. Very good. Yay. You're very lovely.
Good palate.
I'm sorry. Go fish, Shelly. Good. Let me have a quick listen. Make sure I hear something quite normal.
Is that a special kitten-sized one?
It's a pediatric stethoscope. What kind do you have?
They call it my Barbie stethoscope.
Barbie.
It's very cool. It's up there on top of the table.
It's a pediatric. I bought 2. They both sound slightly different, just in case I was going to have some trouble. But I'm hearing them easily with this one, which is the Good. It's smaller, so I can focus it over a smaller area, and you don't. Because if I put the big stethoscope on, I would hear the whole cat intestinal sounds and lungs, and not just heart valves and stuff.
Oh,
So I don't want to hear the whole cat at one time.
I hear lots of purring when I do.
Yeah.
See, Barbie stethoscope.
Oh, that's a nice one though. That's a Littman one. That's very fancy.
It sounds good to
I
me.
bet.
Yeah.
Oh, a pink one.
I know, fancy, fancy, fancy.
I've had this one for a long time. I think they look amazing.
Okay, good. I feel better now.
Yeah, there is some type of little malformality or malformation to the first one, but I think it's not
And his tail.
interfering
Did you
with.
feel his tail?
Yeah,
He's got a kinky tail.
I know.
It's bent.
I think he has little Megs in his jeans, or
Maybe.
who knows? Who knows?
Something special. He's
Yeah.
extra special.
But he moves his back legs. Just make sure he poops normally too.
Okay.
But if nothing's coming out his nose, I don't see any holes up there.
See how strong he is? He's
Yeah.
like the biggest, strongest one. With the most special face. Made for bulldozing.
He's like a bulldog.
Yes. He's going to be everyone's favorite kitten.
Yeah. He might look a little special. Look at him though. He's very
Just knocks them
adorable.
all off.
Aw. Good job, Miss Dorothy. You're beautiful kittens.
Okay, good. So nothing to worry
I
about.
don't think so.
Just feeding and...
I think if the whole sort of oral nasal cavity is functioning well,
Yeah.
that's the most important.
Good.
Maybe no cat shows. I don't know.
He may not win any beauty pageants in the traditional sense.
Yes.
All right, good. Thank you so much for
You're
coming
welcome.
after work.
Welcome. No questions? You're good?
I think so. Oh, don't forget, Dr. F wants a picture of his face.
Oh, right. Thank you. He's like this right now.
He's got a
on
wide
his phone.
stance sometimes. Hey, buddy. Hi, buddy.
I do. To see. Parental question. How are you doing? My parents care. I'm going to be a little mean and hold him for just a second.
Okay.
Sorry, monkey. Because I might post you if I can't find a... It's kind of a little bit, because the coloring makes it look, I think, worse than it is, because it's pigment.
Mm-hmm. Because his nose looks like an X.
Right.
And then so the red hole.
Okay. I will see if I can see the answer of exactly what this malformation has caused. And see if maybe, because there are reproductive specialists, and see.
His face is flatter.
Does he seem to, well, maybe he seems to be able to breathe out of his nose.
Mm-hmm.
Even though his nostrils are smaller and to the side. That would be that he doesn't have to open mouth breathe or something?
Yeah, he seems like he's breathing normally.
Like, I don't think he's... Okay, I will leave you alone for now. I will check in with you at a later date.
He's so cute.
This light probably generates some heat too, hey?
Yeah. Yeah. And then I don't have to have the direct overhead light on there.
And you're good. I'm going to leave you with some... Oh, that was your phone, sorry.
Oh. Making good.
Your family checking in with you versus mine. And you wanted me to leave you with a few supplies just in case?
Oh, yeah, that would be good.
Do you know how to open this if we leave it sterile? Because it'll be much... If we don't puncture it, it will stay better longer.
Okay.
I can explain it to you.
Yeah, explain to me. And I have your scissors too. Is there a special cleaning protocol, or do you send them off to be cleaned somewhere? To be reset?
I have a wonderful staff, and they will clean them tomorrow. And we have an autoclave in the hospital.
Okay, because I like betadined them and stuff, but I probably didn't get like all the little.
That's okay.
I'm sure. Well, they're not sterile.
They get scrubbed in surgical milk in autoclave.
Okay. And thank you, because that was much better than my other scissors.
It's like you don't need to buy a $100 pair of scissors for 3 times a year. I'll probably be able to find you. So this, when you want to open it, well, I kind of want it to stay nice and clean for you, because then you can put it away and potentially even like use it in 6 months.
Okay, yeah.
You just tear the bag.
Yeah.
And then what you do is, and you tear this open also. Okay. And I can explain it to you at the time too, if need be. Is that they pull the blue thing off, and then you're going to take. There's one thing on here that has a sharp end.
Oh, okay.
This, and it's protected. You're gonna pull that off and stab it in there. Okay. And then you just let gravity go and drain it.
And it's good for how long?
It probably has an expiry on it.
Okay. And I can keep using this.
Expires April 2015.
Oh, okay. What year is it? Oh, it's 2014.
So it has 6 months.
Yeah, that's good.
6 months.
And I can keep using this just with new needles.
Yes. I mean, ideally, I don't think that you should use this longer than a week.
Okay.
And every time you use one, use a new thing on it. Do a new needle.
Yeah.
Absolutely.
I've been doing new needle, but I have
an expiry on this, but I bet you it's like more than a year down the road.
Okay. Awesome.
Because we go through these like crazy, so yeah, I'm not worried about the expiry on that. But this is Pro.
Thank you.
And then you need needles. So so my favorite thing you can also do is you can take fluid out of here using that port, and you don't have to pull. And then you could do a needle, like, so there's individual.
Like this would be kitten size. Right. Yep. That would be easier.
Like
sometimes.
5. Yeah. So say I can help you calculate depending on how dehydrated they are. It probably, depending on size, now it'd be like, I don't know, 5 cc's, 10 cc's when they're 8 weeks old, depending on hydration and what our goal of giving them sub-Q fluids is. Sometimes it's as much as 20. So it might be easier to use something like this. She'll leave this with you. And then there's different size needles in there. Okay.
Awesome. Thank you.
You're welcome.
It was kind of handy in the past.
Yeah, emergency.
To have an emergency stash.
Fluids.
Yep.
And this goes with me.
Awesome. Thank you.
You're welcome.
Yep, very good. All right, those are just prophylactic fluids in case someone needs them at some point.
Getting a little dehydrated and electrolytes.
Yep, it's good. It's good to have on hand.
Because then you won't need them.
Yeah, exactly. Or like Chef got some, and like I've had Olaf got some the other day from another batch. It's good to have some just in case. Okay, yeah, you have everything? Good, good. All right. Kittens. Oh, I'll help. I don't need help.
Help! Some husband, come and get us out.
I know. There have been times when it's taken me a while.
Hi! You sitting up here waiting for your mom?
We've been a little lonely lately.
I bet. I was wondering about that.
A little full of bow.